Imagine a journey into one of the most complex landscapes you can think of, the human body. It's a place filled with winding roads and absolutely critical supply lines, where just one single blockage can spell disaster. So today, we're going to follow a surgeon on a mission deep into the leg, using their roadmap to restore that life-giving flow. So really, how do they do it? When an artery, one of those vital highways for your blood, gets totally clogged up, how does a surgeon actually find their way through all the layers of skin and muscle to get to that one specific spot, buried deep inside? Well, they use a map, but not one made of paper and ink. This is a map of anatomy, of skill, and of pure strategy, a surgical roadmap that's been perfected over decades. So come on, let's dive in and trace the exact route surgeons take to get around those dangerous blockages, from the main highways all the way down to the tiniest local roads. Okay, so before we even start driving, so to speak, we've got to talk about the rules of the road. Before any incision is ever made, every single surgeon heading into this territory has to follow a set of non-negotiable principles. Now, this is where it gets really interesting. These rules basically govern every single move. You have to have a clear view, right? So the incision has to be long enough. You've got to handle veins gently because, hey, you might need them later to build the repair. Protecting every nearby nerve, that's a given. Keeping the area bloodless for pinpoint precision is a must. And when the work gets really tiny, you bring in magnification. These aren't just tips. They are the absolute laws of this landscape. Okay, with those rules locked in our minds, our journey can really begin. And just like any good road trip, we're going to start at the main hub, that central interchange where all the major routes come together. All right, let's get into our first major section, accessing the main highways. We're starting out in the upper thigh, which is home to the big, high-volume arteries that feed the entire leg. And here it is, our starting point, the femoral artery complex. Seriously, you can think of this as a massive highway interchange right in the groin. This is where the main artery coming down from the abdomen splits into the primary routes that carry blood down the rest of the leg. For most of these procedures, this is ground zero. So leaving that main hub, you have the main interstate, which is called the superficial femoral artery, or SFA. It heads south, traveling right down the thigh, but it's not on the surface. It's deep inside, protected by this amazing tunnel of muscle called the adductor canal. This is the super highway for blood flow. But, surgery is never that simple, right? What happens when there's a roadblock? I mean, what if a previous operation has left the main on-ramp just covered in dense scar tissue, making it totally inaccessible? You can't just give up and go home. And this is where surgeons get really smart. They have planned detours. If that main route is blocked, they can use a completely different approach, coming in from the side of the thigh to get to the other major highway leaving that interchange, the deep femoral artery. It's kind of like finding a different on-ramp to get traffic moving again, completely bypassing the problem area. Okay, so we've navigated the big, wide-open highways of the thigh. But now the map gets a lot more complicated. We're moving down past the knee and into the twisting, narrow, local roads of the lower leg. And the first major challenge is right behind the knee, the popliteal artery. This area is just packed with critical nerves, veins, and muscle. It's known as notoriously difficult terrain, and choosing the right path to even get to the artery here, well, that's everything. And check this out. This gives you a fascinating peek into surgical strategy. Do you take the medial approach, coming in from the inner side of the knee? That's like the front door, and it's great for complex cases. Or if the problem is just in one little spot, do you use the posterior approach? That's the back door, and it uses this clever S-shaped incision to prevent scarring that could mess with the knee's movement later on. The choice is all about the specific problem you're trying to solve. As we keep heading south into the calf, the journey gets even harder. Our roads, the arteries, are getting smaller and narrower, and they're no longer out in the open. Now they're buried deep inside these tight compartments, basically sandwiched between muscle and bone. Which brings us to a really fascinating puzzle. How on earth do you repair an artery that is literally tucked away behind a major bone, completely hidden from view? This is one of the most ingenious maneuvers on the entire roadmap. To get to that hidden peroneal artery, surgeons take a radical route. They make an incision right over the fibula, that's the outer bone of your lower leg. They carefully peel the muscles away, and then, get this, they surgically remove a piece of the bone itself. And right there, lying just underneath where the bone was, is the artery. It is an absolutely incredible solution to a very complex problem.
So we've followed the map, we've navigated the terrain, and we've reached our destination. But the job isn't done. The final step of this journey is to actually fix the roadblock. Now, it's time to build the detours.
A lot of the time, the final destination is right here, the tiny, unforgiving arteries of the foot. These are the last little driveways on our map. They are incredibly small and delicate, but successfully restoring flow to them, well, that's often the difference between losing a foot and saving an entire limb. The stakes just could not be higher.
And the way surgeons build that new route is with something called a bypass graft. This is the ultimate detour. They take a healthy vessel, usually a vein from the patient's own leg, and they stitch it in place above and below the blockage. It creates a brand new, wide-open road for blood to flow through, restoring circulation to everything downstream.
And this quote, it just gets right to the heart of it. It shows the incredible impact of this whole journey. All of that intense navigation, all that delicate work, it all leads to this profound outcome. A single successful bypass to one of these tiny driveways in the foot can bring an entire limb back from the brink. This whole surgical roadmap is just a testament to human ingenuity, but it really makes you wonder, doesn't it? As our technology allows us to map the intricate pathways of our own bodies with even greater detail, what new, less invasive, and even more effective routes will surgeons discover next?